Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon, my leprechaun co-host.
Yes.
Nils, I haven't asked you to cue anything recently. Can we get, pot of gold.
Okay.
Pot of gold. Rainbow. Ooh, pot of gold. It is almost St. Patrick's Day. If you're listening to this after that, well, it was St. Patrick's Day when we were recording this. So this episode, we are talking about everything you need to know about face and neck lifts, specifically for men.
And we know every March we talk about March Madness, Shamrock Shakes, and facelift for men.
That's apparently a new tradition.
Yes.
But if you're listening to this podcast and you'd like to watch it on YouTube, you can find us at Beauty and the Surgeon Podcast and at Jason Martin MD. All of our social media handles are linked in the description box below. So we did an episode years ago that was face and neck lifts for men. And I felt kind of bad because we basically just say in that episode, like, yes, men get face and neck lifts too. And we didn't really go into detail about it. So this, we're doing it's a two-parter. In the first part, we're going to talk about who's a candidate, how to find a surgeon. And then in part two, we're going to talk specifically about the different types of surgery, like in more detail about how they're done, what to expect for recovery, downtime, all that kind of good stuff.
Yeah. And to be honest with you, if you're a woman watching this, this could be really helpful for you too, because the facelift part of it, like how I approach it, is pretty similar. But there are some distinct differences about assessment, about the surgical plan, and then also the additive procedures that we do. That's where it's going to be really important for, I think, men to really listen to see like how a face and neck lift surgeon approaches the male facelift over a female facelift.
Yeah, because there are differences.
There's a lot of similarities though, so it's going to be applicable for everyone.
Yeah. So let's jump right in, and we're going to talk about the statistics. This is from 2024.
Yep.
And this is looking specifically, I love that they actually started breaking it down between men and women. So if we look at the total number of face and neck lifts, we were around, 100,000, a little over 100,000 in 2024. And then the male population there was a small percentage, about 7,000 of that 100,000. So it is still only 7 to 12% of people having face and neck lifts are men, but that is going to be changing. I think just as we have a healthier aging population, we're definitely going to see that change.
Yep.
And you can see that in the numbers, that the biggest population for men having these procedures is, in the middle, right? Between like 40 and 69. And then over 70, things start to drop off a little bit for men and women. So that is true across genders, but interesting.
So we're looking at face and neck lifts, 7% are men, at least nationally. That's what
7 to 12.
Okay.
Yeah, 12% for neck lifts and 7%.
Yeah, that's not too far from us. I mean, we're probably more in the 12 category. Or
yeah,
15%.
12 to 15.
Yeah.
Yep. And like I said, I think that is probably going, you think this was back in 2024. So the statistics are always a couple of years behind where we're recording, just because it takes time to, run the numbers, do the data, do the things. But
finally they caught up with this. Can you say the word?
There's no need to.
Say it. Just say
Nope, it's in the past.
All right.
Yep.
Stats.
The statistics.
There you go. Look at you. Nice.
Statistics. Yes. So let's talk about the things that a face and neck lift can address.
Right. Real quick, I just want to go through why we need face and neck lifts. Like what happens? You have intrinsic aging, the stuff that's on the inside, genetics, the way you were born, and extrinsic reasons, which are a lot of the things that men are not great at. Now, me personally, I'm awesome at putting sunscreen on. Amy knows that.
What's that sunscreen smell like?
We're not sure. Sunscreen.
Oranges. It smells like oranges.
Smoking, lifestyle factors, drinking, sleep,
stress.
Mm-hmm.
And if you actually go back and listen, a good one for men to listen to about those intrinsic things with aging is our episode about what do we call it, Nils? How to
things you can do without doing surgery.
Yeah, without doing
make your
surgery.
Look, but that was right at the beginning of the year.
Yeah, right at the beginning. It was
no needles, no.
Yeah, no needle or no knives, or needles
Nils
required.
Going to show you right here.
And we talk about those things like even having companionship and how to manage stress and sleep, the things that you can absolutely do that affect the way you look on the outside that you can absolutely impact on everybody.
And those extrinsic thing, the EX ones, are a big factor in the way we look as we age. But you have intrinsic things inside of you that you can never change unless we start changing your DNA around. For someone that's more fair skinned like Amy and I, you get to your 50s, like where I am, low 50s, you start to see these changes. It's inescapable, even if you're doing all the other things right, like putting sunscreen on all the time. The other thing I want to say is that men actually do age better than women when we're talking about the face and neck. Women, perimenopausal women, within the first 5 years of perimenopause, have a 30% reduction in their collagen, specifically on their face.
And that's down to, I mean, by the time you reach 30, you basically are not producing elastin at all anymore.
Right.
And then you have these massive hormonal shifts through life.
So women, the reason women tend to like age more quickly than men when they get to their 40s and 50s because of that huge precipitous collagen loss. Now you can do HRT and that'll help, but it doesn't solve the problem. It doesn't all of a sudden maintain your collagen. Men start with 40% thicker skin, and they only lose a couple percentage of the collagen per year.
They also have more bone mass and other things that help keep the support structure of the face.
Yeah. So men in general tend to age better on the face and neck, but some of these things you can't escape. The way that this stuff starts to form underneath your neck, the way your eyelids look, even the kind of stuff that's going on around your mouth, less jowling because of, as Amy said, you have a strong mandible and foundation there. So men do definitely have these problems, just it's less evident than women. But what has changed the game, and I said this in the previous episode, is the weight loss, that we're seeing more precipitous weight loss with people on GLP-1s. That's where they're coming in earlier and earlier with the face and neck. If you lose 60 pounds, 50 pounds, 40 pounds, 100 pounds, 150 pounds, you're going to see it in your face and neck. Maybe it's not enough to do a face and neck lift, but you're going to have some presentation of that. All right. So a face and neck lift, what can it do? Amy, what's the first thing it does?
I'm going to let you keep going on this.
Okay. Improves the signs related to facial aging on the face and neck. And what are those signs, Amy?
You have covered all of them.
Right. Wrinkles around the eyes, descent of your cheeks, lines, kind of sunkenness around your mouth, ill definition along the jawline, that's jowling. Your neck and profile, you see this kind of extra skin, or if you're a little bit heavier, you see kind of heaviness and fat there along with loose skin. These are the signs of aging that we see all the time, and this is what a face and neck lift can treat. Amy has on here that it can enhance your self-image and confidence. So why don't you give us your input on that?
Yeah, it absolutely can. I mean, I think the biggest complaint we get from most men is more on the neck than on the face in a lot of cases. And, especially men who are having to wear collared shirts and other things that really, like, you can't hide it. I mean, even our, and I don't want people to think that this is only for men who've lost weight. It absolutely is not. Like, most of the men who get face and neck lifts with us have never been overweight a day in their life, but they still have all these issues. Like, it's not a weight loss issue for them. Like, you're going to have this loose skin no matter what. And that's tough, when you're still trying to be very active in your profession and you have like skin that's hanging over your shirt collar. Like, it doesn't feel great. Yeah.
That's a lot of the men that come in. They tend to be professionals. Mm-hmm. They tend to be in fields that are pretty stressful, somewhat aggressive,
forward facing.
They want to be relevant. Maybe they're in a more sales position or a leadership position, and they start to see these changes and they get fearful about their relevance in the workplace too. That's real.
Yeah. The other thing too is that it fixes the internal structures of the face as well. Not just the skin, not just the jowling, but also can help bring the muscles and the fat back to where it needs to be.
Right. That deep layer, do you have a slide on that?
Nope.
Okay. So the deep layer, which is the SMAS, which is that foundational layer underneath the skin and fat that's there, that loosens with age. We've talked about this many times before. When that foundation droops, that's when you see all the signs of aging below your eyes. The heaviness along the nasolabial folds, that feeling that your face is kind of sunken right below your cheekbones, and then it starts getting more droopy as you go down to your jawline. And then that progresses down onto your neck. I mean, this is universal, as Amy said, it doesn't have to have with weight loss. And every man is going to go through this. So that foundation layer is essential during the surgery for that rejuvenation effect.
Yeah. So what are some things that a face and neck lift will not do?
It won't change your personality, unfortunately for me, and it won't change your fundamental appearance. A face and neck lift done correctly will not change your fundamental appearance. You'll still look like yourself. You just look a little bit better, a little bit more refreshed, maybe a little bit youthful, but I mean, honestly, but just more like yourself, more cleaned up. A lot of people, after a male, conservative, natural male face and neck lift, they'll look at you and say, hey, did you lose weight? You look good. You look refreshed. You don't look different. You look like yourself. Also, it won't stop the aging process, which is unfortunate. If we had a pill, we'd give you that and sell it to you. Amy and I would be on an island.
No, we wouldn't, because they'd only take it once.
I know, but we'd sell it for a lot of money.
We'd sell it one time for a lot of money.
You're right. I mean, it would be $1 million pill. Okay. We'd sell a couple a year and be on the island for the
That'd
rest.
be good. Yeah.
But it won't stop the aging process. Aging, as we talked about, is intrinsic, what's inside of you, genetically programmed. Extrinsic, which is all those external factors that do make a big difference on the aging process. And it's the way those combine together to have this presentation, this physical presentation that goes on no matter what you do, no matter how healthy you eat, no matter how much you work out. It's inevitable.
Well, more than that, the reason I put this in here is because, a lot of men, specifically women, do this too. They think that they just want one solution. Like, okay, good, that's it, I'm done forever. I'm like, you're going to keep aging. So depending on when you do your face and neck lift, you probably will have another one. Like I always say, hopefully you will have another one because you're going to be living a long, healthy life. So yes, if you
Amy and I are shooting for 4 or 5, I think.
Yeah. Oh, I'm for sure on the 4 train. But if you are concerned about, changes in your fundamental appearance or things looking obvious, go back and listen to our last episode about plastic surgery myths for men. We do address that specifically about things looking fake or overdone. So definitely listen to that one too. All right. So who is a good candidate?
We say this every time, healthy enough for surgery. And what does that mean, Amy?
It means you are healthy enough for elective surgery. You do not have uncontrolled high blood pressure, uncontrolled diabetes. You're a non-smoker. You live a relatively healthy lifestyle.
You're not on blood thinners because you have atrial fibrillation.
Right. Yes, if you have high cholesterol, it is controlled with diet and lifestyle and medication. Like you have healthy blood markers, healthy heart, good EKG.
You can walk upstairs without being out of breath. You're active. You're not on chronic pain medications because you have severe back problems. There's a lot of things that men present with that would preclude them from doing this kind of surgery.
I wouldn't say there's a lot.
There's definitely, and there's immunocompromised positions, and or there's actually people that have medical conditions that they're immunosuppressed. There's a lot of different things that they could present with. Now, I think what Amy is referring to is a lot of times we can work through that with your primary care physician and your specialist, but it takes some work to be able to get you to the point where we can take you to the OR.
Yeah, but most people who are considering surgery are probably healthy enough for surgery for this type of surgery. Having a realistic expectation and positive outlook are also key to making someone a good candidate for surgery. That's true of any surgery. The realistic part of the expectations, that's between, you and your doctor and making sure you guys are on the same page. And a positive outlook, you're just going to heal better if you're a positive person.
Yeah. Life's better when you're positive.
Yeah. That's what I mean. I think the type of people that make it into our office are almost always a candidate for surgery, sometimes with medical clearance. Sometimes we have to do something in the office under local anesthesia only. There's always options if you've got a good realistic expectations.
That's another point, especially for men. There's always usually an option, even if you cannot go to the operating room for medical conditions. We actually have answers for that too.
And we've had some men who had some heart conditions that precluded them from having anesthesia and other things. So, but we find a way.
Yeah.
Where
DNEs.
there's a will.
Yeah.
And a positive outlook.
Yeah.
Yes. All right. So let's talk about specifically for men. What are the different types of facelifts?
All right. So this gets confusing, but it's pretty simple. You can isolate a facelift, isolate a neck lift. You can do a combined face and neck lift, and you can do a isolated face or neck lift in a kind of shorter incision fashion, or what we call a mini, or you combine those and do a short incision face and neck lift. And then also we talked about before the foundation. That foundation layer is the reason that people age mostly, besides the skin changes. And that foundation layer can be treated in many different ways. One of them's a deep plane, one of them's a smastectomy or a SMAS plication or a SMAS flap. We'll get to that later on. But in general, a deep plane facelift doesn't do as much skin elevation, whereas the full or traditional facelift does. The neck lifts, no matter what people tell you, are pretty similar. That involves some elevation of skin around your ear, and a lot of times for men, you almost have to elevate underneath the chin too to really redrape that skin and also tighten the muscle in that area.
Yeah, get rid of the waddle. They all call it the waddle, the turkey neck, the waddle. We also, if you look at this list, we start at the top, meaning the smallest, right? A direct neck lift. We'll talk.
Oh, I forgot about that. Yeah, direct neck excision is an amazing surgery, and that's where you put an incision underneath your chin. It's visible, But some of those results are remarkable. And that's a less than an hour procedure in the office with you totally awake. You walk in and walk out.
Yeah, very minimally invasive, but can also address some of the musculature of the anterior part of the neck as well at the same time.
You can do the platysmoplasty or tightening of the muscles at the same time. You can do liposuction. We've combined it with FaceTight, which tightens the skin. I mean, there's so many different options. And by the way, that direct excision neck lift is turning out to be like one of those Swiss Army knives. It's going to be applied in so many different areas for so many different types of patients, both male and female.
Yeah. More than anything, though, I think when you look at this list, the best thing to do is to find a board certified plastic surgeon, which we're going to talk about next. But I try to always tell people, like, don't get caught up in what these things are called, because a lot of offices are going to call them a lot of different things. And they're going to tell you that this is the only one, or that this is the right one. And truly, it doesn't matter what anybody calls it. If it doesn't fully address your issues, then it's not the right one.
Yeah. You want to go to an office that's bespoke, that looks at you as an individual, does a full evaluation, and then comes up with a surgical plan that makes sense for what you're presenting with.
And it's a face, if it's a neck lift, it's a neck lift.
And I'm sorry, like if you just go on TikTok and say, I do direct excision neck lifts or deep plane facelifts or
mini neck lifts,
or even better, you say a name, ponytail, or
the ponytail lift.
The name of the doctor. Mm-hmm. By the way, if it has the name of the doctor in it, it's probably not special, to be honest with you.
It's definitely not.
People like me, or offices like mine, we do everything. We do all different types of approaches. We do every different thing you can imagine. And it's tiresome if you had to have a special name, like a kind of a cartoonish name for every single procedure you do. What we do are, offices like ours, and there's a lot of them around wherever you're watching this. You have a good expert around where you are. We do what the patient needs. And that may be a deep plane. That may be a full neck lift. That may be a mini face and neck lift. We may combine it with a blepharoplasty, do a brow lift. You name it, we do it. Is this what you need? And a big part of deciding what you need is that conversation that you're going to have in the consult. What are your expectations? What bothers you? What's your lifestyle? What's your budget? What are you willing to recover from? It all adds into it.
Yeah. So don't get caught up in the names is really what I'm trying to say. Like, it doesn't matter what someone's calling it. If it doesn't matter. It needs to address your issues. You call it whatever you want. If it doesn't,
you can make up names yourself.
Yeah, exactly. You call it whatever kind of facelift
Nils
you want.
does.
Yeah. All right. So we're going to take a quick break, and then we're come back and talk about how to choose a surgeon.
Oh, I love this part.
And we're back. All right. So this is actually, I think, probably the most important part of any of our slides ever is how to choose a surgeon. Because like we just said, with, you can call surgery anything you want. If it's not the right surgery for you, it's not the right surgery for you. Doesn't matter what your thoughts are about a surgeon. If they're not the right surgeon for you, they're not the right surgeon for you.
I think the next patient that comes in who wants a face and neck lift, I'm just going to name the surgery after them. Mm-hmm. Oh, by the way, this is the surgery I do, and it has your last name in it.
Yeah. Or this is the Jane Plasty.
This is the Jane Plasty.
Mm-hmm. Yes.
Isn't that amazing?
You're the only one who's going to get it.
Completely.
You get a special ribbon after it's done.
Right. We're going to name this after you. But it is most important to find a board certified plastic surgeon. If you're in the United States, that's going to be certified by the American Board of Plastic Surgery. There is no American Board of Medical Specialties that recognizes any board with cosmetic surgery in its name. So if the person you're going to says they're a cosmetic surgeon, that is not the same thing as being a board certified plastic surgeon.
And we see this a lot. People that are trained, I'm not saying they're bad doctors, like ophthalmologists or ancillary subspecialty surgical professions, they'll refer to themselves as plastic surgeons. Mm-hmm. In all of their ads and at their office, and you need to do that research. And if they are an ophthalmologist or oculoplastic surgeon, like ophthalmologists that have eyelid training, cosmetic training. I mean, there's a whole litany of things. You can be an ET surgeon and have no cosmetic training, call yourself a plastic surgeon. That's called facial plastic. So it gets in the nuance, and everyone says plastic surgery because it's probably easier, and also it's pretty coercive. Mm-hmm. I think it's important to go to someone who is a plastic surgeon, personally board certified, but at the very least, an ENT surgeon trained in facial plastic surgery, in some rare cases, an oral maxillofacial surgeon, someone that works on the face all the time and has had training in it.
Yeah, and you can find the link to find a doctor in your area. It's actually linked in the description. So go to that link, plasticsurgery.org. So results and aesthetics that match your desired outcome. I feel like we've covered this one thoroughly. You got to make sure you guys are on the same page for sure. And someone you're comfortable with.
Right.
Yeah. Dr. Martin, you really talked about this really well in our last episode about myths. I know I keep referencing that, but I definitely recommend anyone go back and listen to that, you should really trust your instinct too when you choose a surgeon. Like obviously make sure that they're board certified, but I find it interesting when people are like, oh, well, this person's double board certified. Well, that does not make them doubly better.
Who cares?
Yeah. And they might be double board certified in family medicine and obstetrics.
Right.
They're not the plastic surgeon for you.
So, I mean, the common one on that is I'm not sure if, I don't know. I might be speaking out of turn. I think it's like if you do ENT and then do facial plastics, you can get double boarded. Mm-hmm. Well, that's you did ENT and then you actually did a plastic surgery type of fellowship. So I did general surgery and then I did plastic surgery. I could be double board certified in general surgery and plastic surgery. Mm-hmm. I chose not to do general surgery for obvious reasons, but I don't think it makes any difference at all personally. I mean, the acumen of the person who's willing to do an ENT and plastics fellowship, I've only met 2 people like that in my entire career. So that's amazing. And their drive to do that. But that,
or if they're double board certified in hand surgery and plastic surgery, is that going to make your facelift better? No.
Right. Also, me personally, I care about training. And that's something I would look at personally. But training is one thing, but experience and what you focus on is the other. You can go to a double board certified plastic surgeon who doesn't really do facelifts a lot, and then they're trying to convince you to do a facelift with them. So really it's about the surgical experience of the person. I think their training does matter personally. And then also what their focus is on their practice. But this idea about having their results match your aesthetic vision is so important, especially for a man. If you're a man and you, this is getting Groundhog Day. I think I've said that before.
No, you say if for women out there is what you always used to say. If you're a woman out there.
Oh, yeah. Okay.
I finally got you to stop saying that. Now you're going to start saying if you're a man.
If you're a man.
If you're a man out there.
If you're a man out there. But if you don't want to look different, you just want to look better, naturally improved, still look masculine, still be the person that you are. I mean, you need to see pictures of these people looking normal. You need to be able to look those people in the eyes. And like, as Amy said, I was referring to last time, have the gut feeling that they're telling you the truth. I think it's super important, especially for a male face and neck lift. You got to have self-control with these kind of surgeries. If you go in there and wreck yourself before you.
That's true of surgery for men and women. Though.
I know, but there's less leeway with men. If you go in there and don't have self-control, you're going to end up looking different, and that's going to be really distressing.
But don't let that be a myth that keeps you from doing surgery, because we busted that myth that you're going to look weird or fake.
If you go to someone who does it on a regular basis, has male patients, does male face and neck lifts.
Yeah. You got through the myth. That's why you're here.
Yeah.
So let's talk about what happens at the consultation. Now, when I say full medical history, guys, this is the time to tell me all the things.
This is such a man thing.
The medication, it's not just men, it's women too.
I feel like the men are worse.
The medication, I don't know. Oh, gosh. How many times as a woman, like at the last second told us something. Your current medications, all of your medications.
Oh, last time I had anesthesia, I almost died.
Right.
Forgot to tell you that.
Yes. I need to know
that would have been important to start with.
All of your previous surgeries, not plastic surgeries. I mean, I want to know those too if you've had them, but like I need to know if there's metal in your body, if you've had a total knee.
If you've had a liver transplant.
Right. All of those things. The supplements you're taking. If you've been a smoker, if you're currently a smoker, if you're currently using drugs, like these are things we need to know because they're going to make sure that you have a safe and healthy outcome. So those are number one. Discussing your options, expected outcome. Dr. Martin covered those things. We'll also provide a quote typically, review the risks and complications, before and after pictures, like Dr. Martin mentioned, are very important, and answer any questions you may have. Dr. Martin, what are some questions that they should ask their surgeon?
First and foremost, do I need this procedure? Am I a good candidate? Mm-hmm. Think about that. Like, have them look at you and have them speak honestly and openly. What do you think? If they say, well, maybe this, maybe that, that's kind of a good idea that maybe you shouldn't do it.
Or they're not the right doctor for you.
Oh, yeah.
Some doctors are just kind of wishy-washy.
Yeah, I cannot stand the wishy-washy types. I don't like that, but that's just...
They do exist, though.
And I don't like that. Yeah. I don't like wishy-washy because I feel like they're just waiting for me to say the answer, and I came to you as an expert. What kind of technique, what kind of approach would you use? Again, if you go to a proficient facelift surgeon, preferably a plastic surgeon, but it could be an ENT surgeon by training that does this on a regular basis, then they should be facile with all different types and apply it to your anatomy for what you need. Please, for the sake of God, don't go in there with a procedure that you saw on TikTok. Heavens, all the time now. And people are like, well, I want this. And I'm like, well, that's cool. I like that. I mean, that's the world I live in. I like cool procedures, but you don't need that. You need this. So ask them, what is their professional opinion? Where will your surgery be performed? So important. If it's performed in a double wide trailer out in the country somewhere that's not clean, then you don't want to do that. They need to be a certified operating room. Ask them where it is. Look it up on the internet. All that information is available. What are the risks and benefits of this surgery? That should be discussed at length, but you go in detail. Ask them, have you ever had a complication? See what their response is. You can know right away when they're like, oh, I've never had a complication in my entire life.
Or you'll be fine.
Yeah, please. And how are complications handled? Such a really important conversation, actually. This is why Amy has been so additive to my career for many reasons she has, but for this part, open and honest discussions with people. Tell them openly what happens when this happens. So if it ever happens, then they know they're going to be taken care of. And how do I expect my face to look afterwards? Both right afterwards, at 3 weeks, at 6 months, and 1 year, etc. Scars, where are they located? What do you do if my scars look bad? You know, there's these rabbit holes you can go down, but they're really important to talk about with the surgeon.
Yeah. This is your time. Like when you come in for your consultation, like bring your questions with you. It's really, especially in some offices, you know, you get in and it can be kind of overwhelming, right? Especially if the doctor is kind of
doctory.
Yeah. You know, maybe doesn't give a lot of time for you to, to listen, and like you might be nervous. You know, that's totally normal to be nervous. Like I tell people, like write down your questions ahead of time. That way you have them. It's so much easier when people when I say like, do you have any additional questions? And they go, oh, I feel like I probably do, but I don't know. I'm like, write those down. You know?
We love questions. Writing down questions is probably the best thing you can do. Even if you feel like this is a dumb question, they're not. So at least in our office, we love questions.
We always put those in the description below.
Yep.
So take a photo or print them out or whatever else and take those with you.
Start playing our video in your consult. See how that goes over.
We've had people tell us they did that.
Oh, no.
Yeah.
Just bring the questions, write your own.
Yep. So after you've had your consultation, you've decided, yes, this is the doctor for me. The next step is going to be a pre-op appointment. At the pre-op appointment, they're going to take your pictures, so be ready for that. They are also going to reveal your health history. This is the time. If you were holding back about anything in your health history, do not hold back any further.
Do not hide your health history from us.
Tell it to us now. It's going to come out because we're going to send you for pre-op labs, an EKG, potentially. We're going to tell you what medications to continue, what things you need to stop, when you need to stop them. So these are really important things. Like this is elective surgery, but it's still surgery. And we want it to be safe. We want everyone to come out healthy and alive. Like you can do your part by being honest.
So your health history includes your illnesses you're dealing with, as medications you're taking, your surgical history, what's happened in the past, including how anesthesia affected you, and your allergies to medications. I can't tell you how many times people haven't told us about their allergies, even though we've asked them.
Yeah. Or if you have sleep apnea, like tell us now. Yeah.
That's super important. By the way, can we just talk about this real quick? This is such a great point. If you have sleep apnea and you wear
CPAP,
a CPAP machine, and we do a facelift, those CPAP straps go over the area the scars.
In some cases, like you can get different ones, especially if you're having a rhinoplasty though, and you use a nasal cannula CPAP, like you're gonna have to switch to the full mask, even if you hate it.
Super important. If you have sleep apnea, which is fine, I mean, it's treatable. Definitely tell your surgeon about that.
Tell them everything. So they're also going to sign consents and most likely take your final payment, to go over your prescriptions, review the date and time of surgery, answer any questions that you may have. This is a great time to bring the person who's going to be taking care of you after surgery to this appointment so that they can ask their questions as well. Some of the questions that you would probably need to know is where you should go, where you're going to be taken after surgery. Are you going to be staying the night in the hospital? What medications are being prescribed? This is when you can tell us that you're allergic to all of them. When are your bandages going to be removed? When can I shower?
Pick up your medications
pick
before
up your
surgery.
Prescriptions. When can you shower? When can you cut and color your hair? With men, most men nowadays are coloring their hair, cutting their hair, all of these things. When can you return to normal exercise?
Shaving your beard after a face and neck lift, or a direct excision neck lift, shaving your beard. Mm-hmm. So many things that will be dealt with at this preoperative appointment. That preoperative appointment is really to assuage your uncomfortableness, your anxiety, to get you focused in a positive outlook. We're going to knock this surgery out of the park. It is about preparing. Preparation is the best panacea for anxiety, for feeling out of control.
And we're going to cover preparing to recover in detail in our next episode.
Nice.
Yeah, that's true. Drains, you might have them. Find out when those are going to be removed. Find out where you should go for your first post-op appointment.
Not back to the hospital.
Very unlikely that it will be back to the hospital. So
unless something was
right.
going weird.
Find out those things. So, Dr. Martin, anything else you want to cover about pre-op appointments?
No, I do think the preoperative appointment for me is a time to look them in the eyes and say, we got this. You know, I think it's, for me personally, I love preoperative appointments. I love getting excited about surgery. I want them to be open and honest with me. Everyone's nervous before surgery. So it's
still surgery.
Yeah, it's not, you're not going to go in there and say, rah, is the best thing ever. It's like, oh my God, I can't believe I'm doing this. That's normal. That's a normal feeling too.
Yeah, like, what am I doing? That's usually as they're handing their credit card over to Catherine at the front desk. Like, I can't believe I'm doing this.
Why did I sign up
like
for
she's
this?
trying to tell them how much they owe. They're like, just take it.
Yeah. Don't tell me the number. Don't tell me
like
the
it doesn't
number.
matter. Just, I can't believe I'm doing this.
Yeah, but this is what it's about. And I'm so, Amy and I, at least, are so excited for our patients. We're so excited that you can go through this transformation process. Amy and I both, as we've gotten older, have started to really appreciate the sense that you can make a difference in your life. And so I think that preoperative appointment is a great way to set the North Star, the direction where you're going, set a plan, and stick to it. So that's one of the most important appointments we do. And discussion of the risk and benefits, I think, is really important too.
Yeah. And that happens a lot at your pre-op appointment as well.
Yeah.
So in part 2, which will be out in 2 weeks, we're going to talk about the specifics. So that's almost as hard to say as statistics. The specifics of the surgeries themselves. We're also going to talk a lot about...
You didn't struggle with specifics before. This is kind of...
I always have.
Oh,
no,
yeah?
I always have. We're going to also talk a lot about recovery, which is what most people want to know about. So the more prepared you are for recovery, the better your recovery is going to be. So it's really important to come back for part 2 and to listen all the way to the end, not just to the fun part about surgery at the beginning.
And since this is about guys, we can talk about the March Madness, who's winning, who's losing, right? Best time of the year.
Who's winning, who's losing?
Well, we'll see.
Oh, so we're not going to talk about it.
Maybe we will. Tune in.
But we'll see you all here next time. Maybe we're going to talk about it.
See you later.